Hey guys, Dr. Eric Balcabbage back for another edition of Thyroid Thursday, and today we're talking about short-chain fatty acids. Many of you may never have heard of short-chain fatty acids, but if you're struggling with chronic immune, inflammatory conditions, thyroiditis, Graves' disease, Hashimoto's, if you've got arthritis, if you've got chronic food reactivity or food sensitivity, if you've done multiple gut protocols, take lots of probiotics and still have chronic immune inflammatory issues and don't feel well, you want to listen to this Thyroid Thursday. So let's talk about what these things are. You have bacteria that lives in your GI tract. They're called commensal bacteria. Think about commensal bacteria as maybe the neighbors, the people that live in your neighborhood. They should be there. You don't want too much of them. You don't want too few of them. You want a nice balance of the commensal bacteria. When we eat, especially soluble and insoluble type fibers from our diet, the bacteria take those soluble and insoluble fibers, they ferment them and produce these things called short chain fatty acids. And there's a couple of them. Butyrate is the one that gets most of the love and attention, but there's a number of them, okay? Now, what's the importance of these things? Well, they do a lot to help maintain health and balance and homeostasis in the GI tract. They are important, critically important for helping regulate the immune system and helping maintain what we call the tight junctions or the intestinal integrity, okay? And those are the two most important things that most of you are gonna be familiar with. You're gonna know that the immune system is important, especially if you have some type of immune-based condition or autoimmune condition or chronic inflammatory condition. And you've probably heard the term leaky gut before. And if you've had leaky gut and you haven't evaluated and addressed or discussed short-chain fatty acids with whoever's helping you, that may be a reason why you might return pretty quickly to having food sensitivities and leaky gut issues after doing some type of functional medicine, GI support formula, okay? So what do these short-chain fatty acids do? They help regulate what are called the T regulatory cells. So when the immune system gets activated, T cells get activated, and once the immune system's activated, we need to calm it back down again. One of the cells that's really in charge of maintaining the balance in the T cell system and kind of calming down the immune system once it gets turned on are your T regulatory cells. And short-chain fatty acids help regulate these T-reg cells. So if you don't have appropriate short-chain fatty acids, there's a high probability you're going to start to develop autoimmune, inflammatory conditions, both in the gut and outside the gut. They help maintain GI homeostasis. They help manage the balance between these different systems. So there's a lot of stuff going on in the GI tract, and something has to help kind of regulate the balance between these systems. So it is the short-chain fatty acids that help maintain the balance between the intestinal cells, the immune system, the commensal bacteria. Again, that's the bacteria that should be in the GI tract, and all the regulatory mechanisms that help run the GI system. So too much or too little short-chain fatty acids can be a problem. Now, there's some, how do you know if you have too much or too little? Well, you have to measure if you really want to know. And there are functional GI tests out there that do measure short-chain fatty acids, and there's some that don't. I used to use a test in the past that didn't have those, and now over the last 5 plus 6, 7 years, I think I've only been running tests that actually have them because of how important knowing where those short-chain fatty acids are. So again, how do we get these short-chain fatty acids? We have to have the appropriate bacteria and then we have to have the appropriate nutrition, these fibers, and then that bacteria ferments the fibers, the food, and produces the short-chain fatty acids that help regulate the immune system and help maintain the integrity of your intestinal barrier. So too much, as I said, too much or too little can both be a problem, but typically what we see is often too little short-chain fatty acids. And this may be a result of somebody's diet. It may be the result of stress impacting the gut flora. It may be the result of antibiotic use. It may be the result of other factors that have changed the gut flora. Could it be things like glyphosate that's potentially changing the gut flora? And maybe that's partially why somebody going on a gluten-free diet sees a benefit, because, hey, if I'm eating less wheat and gluten, there's potentially less glyphosate coming into the system, less damage to the commensal bacteria, and then they can those commensal bacteria can produce more short-chain fatty acids, and that can help to make them have less inflammation, less immune-based issues. That's possible. But typically what we see is the reduction of these short-chain fatty acids, and what, again, is the potential issues that can occur. If you have decreased short-chain fatty acids, you're going to have increased intestinal permeability. That's that leaky gut issue. And for those who don't know what that is, think of your intestinal lining like a screen in your window. It's got little teeny tiny holes to let the air in but keep the bugs out. Intestinal permeability is just that screen has now bigger holes. If I stick my fist through that screen, I've just created bigger holes, so there's more permeability. And that might sound good. Well, then I can get more air in. Maybe, but you can also get more bugs from outside into your home, which can then start to create chaos. In the GI tract, if we have higher levels of intestinal permeability, more undigested food can cross the barrier. That poorly digested food can then trigger immune and autoimmune, and potentially autoimmune conditions, but it can be one of the things that drives food sensitivities or food intolerances. If we have more permeability, bacteria, yeast can cross the barrier, get into the GI and get into the body proper and start to trigger systemic immune inflammatory conditions. If there's more permeability, the toxins from those organisms continue to cross the barrier and create problems. So the intestinal tract is really technically outside the body. It's in the body, but it's actually outside the body. And so if we have too much permeability, then you got too much stuff coming in, and your immune system, 70% of the immune system is on the other side of that GI barrier. And if you have too much stuff crossing the barrier that shouldn't, you're going to really ramp up that immune system, and that can be one of the big factors that triggers immune-based, inflammatory-based disorders. So if you have an increased decreased short-chain fatty acid, increased intestinal permeability, increased food peptides crossing the barrier, increased organisms and toxin crossing the barrier, this drives GI inflammation and systemic inflammation. That can drive thyroiditis that then causes primary hypothyroidism and what we call Hashimoto's. It can drive other immune-related and inflammatory disorders. So what do we do about it? One, if you're a person who doesn't eat much soluble fibers, insoluble fibers, soluble fibers in your diet, try adding those to your diet. You should be focused on a whole food-based diet primarily. And if you don't eat some of these fibers, try adding them to your fibers. Could you purchase fiber supplementation? Absolutely, you can do that. It may be a good short-term strategy until you can really incorporate these things into your diet, but long-term, the best solution is to just make sure you incorporate some of those things in your diet. If you add some of these fiber components to your diet, whether it's food or supplementation, and you don't feel good, then there may already be an imbalance of the bacteria, and some of those bacteria may be over fermenting some of those fibers. And if it doesn't feel good, you want to reduce those and reach out to a functional medicine practitioner to help you understand what's really going on and what's the right solution. If you're going to see a functional medicine practitioner to find out, hey, what's going on in the GI tract, my recommendation would be to make sure that you're getting a functional GI test that then evaluates for short chain fatty acids. Right now, I like the Gut Zoomer as my kind of go-to test for assessing GI function and GI physiology, and other physicians may have other tests they prefer, but that test does measure those short chain fatty acids. Then the next question is, what do you do? Some people suggest, well, just take butyrate if your butyrate's low, but that's like a Band-Aid. That's a good short-term solution to help regulate the immune system, to help maintain the junctions, but you have to address the complexity of what's going on. And that's where you should work with a functional medicine practitioner to understand what's wrong and how to raise those short chain fatty acids naturally instead of just relying on something like butyrate. All right, if you have any questions, put them below wherever you watch the video, and I'll try and get back to you as quickly as possible.